Hi everyone, I'm Rosalinda, president of Love Through Sound. We're a Flemish preparatory school club, and we're a team here to let you know more about the impacts of COVID on those experiencing homelessness. Our presentation basically consists of an overview, first of who we are, why we should care, causes and stats of homelessness and COVID, impacts of COVID on multiple populations, ways we can help, and lastly, a page including our contact info. So without further ado, let's get started. Love Through Sound consists of students seeking to help those needing support, such as those with lower income and those experiencing homelessness, especially during these difficult times. Through tutoring and spreading awareness, we seek to make an impact in any way we can to encourage more support for the community experiencing homelessness. We've made this presentation in support of School on Wheels, an organization advocating for homelessness with the goal of providing a consistent support system to enhance educational opportunities for children who are also experiencing homelessness from kindergarten through 12th grade.
It is important to keep in mind why we should care about this issue. Homelessness is a worldwide issue that is often overlooked yet still very much present today. We should try our best to help those experiencing homelessness and to reduce the amount of homelessness in our world. We thought that it would be necessary to voice out the statistics of homelessness for a better understanding of how large the homeless population really is. In the United States, there are 567,715 homeless. In the whole world, there are 100 million homeless people, with 1.6 billion lacking adequate housing. This means that although they are not completely homeless, they still do not have a stable housing environment to live in. In the Los Angeles County, there are 66,436 people that experience homelessness, which is a 12.7% increase from last year. In California, as of November 2020, there are around 151,000 people who experience homelessness. This number is still increasing throughout time. To put this into perspective, the amount of homeless people in California is equivalent to 5 football stadiums full of people put together. Hopefully, this gives an idea of the large homeless population near us and in the world and what we can do to reduce it.
Causes of homelessness. Causes of homelessness differ greatly between individuals, despite generalizations and misconceptions. Lack of education is a very common cause of insufficient income and difficulty finding employment. Job loss, now very common in the pandemic, can result in homelessness, particularly in Los Angeles, where housing is expensive. Lack of affordable housing and high foreclosure rates can leave many without a home. Other than financial difficulties, substance abuse, disability, and mental health difficulties greatly impact the homeless population, and there are limited resources for help. Such disorders range from cognitive impairment to PTSD. Among women, domestic abuse is the leading cause of homelessness.
If we look closely at these causes, we'll see that much of the time, it really isn't their fault. Yes, most adults can get a job, but not if they're disabled or with a mental condition such as PTSD. That is usually not apparent, as is 40% of the homeless population. 40%. Yes, most adults can get more education if they wished, but most of those experiencing homelessness cannot afford it, especially because they have to worry about daily lacks of food and finances. And what about the children? The 1 out of 20 children who are experiencing homelessness right now. Sometimes what they're taught by family and friends don't lead them to the right paths. And we blame these children that are experiencing homelessness for making the wrong choices, even though these 5% of American children don't know any better.
Children experiencing homelessness. In January 2020, 775 homeless youth were counted in Los Angeles, a 19% increase from last year. There are a few trends regarding the demographics and tendencies of youth homelessness. Youth homelessness disproportionately affects youth of color, particularly African American and Hispanic youth. In spite of being a smaller proportion of the entire population, youths of color account for 81% of childhood homelessness. Additionally, LGBTQIA+ youth are more likely to be homeless, largely due to lack of acceptance by family members or primary caregivers. Furthermore, these LGBTQIA+ youth are more likely to experience harassment and violence. Last but not least, the homeless youth are increasingly likely to struggle with alcohol and substance abuse, which hinders them further from breaking out of their current lifestyle.
Here are some overall COVID statistics. Worldwide, there have been a total of 55.6 million cases. 20% of these cases, or 2 out of every 10 of those infected, are from America, in spite of the fact that the US is only 4.25% of the world's population. This shows the extent of COVID's disproportionate negative impacts here in the US. Currently, as of November 2020, there are about 11.7 million total cases in the US. With this, there have been more than 250,000 deaths. This is comparable to the amount of people who die from heart disease or cancer each year, which are the 2 leading causes of death in America. We see in California there are about 1.1 million total cases and about 13,000 new cases per day. As we can see on the graph, there is a 121% increase in the daily infections from our previous 7-day average, marking a second major wave of cases.
So now let's talk about the populations other than those experiencing homelessness, who's been greatly impacted by COVID, including, but is not limited to these. First, millions of newly unemployed workers, especially those who's lived paycheck to paycheck prior to the pandemic, lost their employment benefit in May and has been struggling to provide basic necessities for their families. Adults in general, who with children under 18 reported negative impacts to mental health due to increased worry and stress, resulting in negative impact in emotional health of not just themselves, but even their children. And the children were even shown to have increased clinginess due to being cut away from interaction from their friends. Teens experience Zoom fatigue, and as a teen myself, I can attest that Zoom fatigue is definitely real. Some have opted for substance abuse, which ultimately leads them to a downward spiral. And elders, on the other hand, have increased mental stress from worry for exposure. Some has dementia in retirement homes, which make the virus difficult to contain. And to put all of this into perspective, these are only the COVID-induced troubles of those not experiencing homelessness. So now imagine if any of these populations are living in addition to experiencing homelessness, meaning additional worry about basic daily necessities, having increased exposure to COVID. Yeah, so that is what those experiencing homelessness have to experience on a daily basis.
Their increased exposure to COVID is due to crammed living, where 75% of California's homeless population do not live in shelters, as well as underlying health issues, which can be attributed to lack of proper health care or sanitary materials. Because of COVID, there's been many widespread closures that have resulted in lost access to services providing food, water, and shelter. There's also delayed testing availability, and they're even more restricted in going out in public, making it very difficult to find anywhere that is safe. But to what extent is COVID impacting those experiencing homelessness? Well, according to the Los Angeles Times, the reported number of homeless impacted by COVID has not been very high. However, it's important to note that the U.S. Department of Housing and Urban Development does not require accounts of infections or death of COVID among those experiencing homelessness. There's also a limited amount of testing, and because of opposition to housing the homeless with COVID, it's hard to know exactly how many people are experiencing its effects. In order to address problems arising from the pandemic, the government passed the CARES Act. The CARES Act, although beneficial, is not able to fully support those experiencing homelessness. Some flaws of this system include communities having less than 1/3 access to the allocated money, unclear federal guidelines on how to spend the money, and added stress to communities as they decide what to do on their own. With these problems at hand, it is clear that our communities and those experiencing homelessness within them are not getting the care they need. However, despite these pressing issues, some people experiencing homelessness have been able to defy the situation and help those around them. On Skid Row, Stephanie Arnold Williams set up a tent and started sewing masks. Those experiencing homelessness are also trying to stay as socially distant as possible, wear masks, and use provided sanitation. Trying to stay as safe as conditions allow, people experiencing homelessness are trying to make the most of the situation. But how are they doing overall? On top of dealing with COVID, people experiencing homelessness have become more disconnected from the rest of society, leading to less job opportunities and the accompanied stress of trying to sustain themselves and those around them. The economic, social, and emotional strain caused from this pandemic has disproportionately affected those experiencing homelessness. Their needs often go ignored and aren't seen as top priorities. As a result, they have a higher chance of being stuck experiencing homelessness longer, which increases their chance of chronic homelessness, accompanied by the increased physical and emotional toll of being stuck homeless longer. Because of this, it is extremely important to help out and support those who might need a lending hand.
Hi, I'm Esther, and I'm here to help talk about some ways that we can help the homeless community during the pandemic. Although the pandemic is extremely difficult for everyone all across the globe, the homeless community has been hit the absolute hardest. With no access to healthcare, minimal medical resources, and very limited transportation, seeking help is extremely difficult during the pandemic for those experiencing homelessness. It is our job to help those who cannot help themselves through taking the standard precautions and following the medical protocols. Some other ways that we can help are constantly washing our hands and sanitizing, wearing a mask that covers both our nose and our mouth in all public spaces and around anyone that is not in our household, being conscientious of those around us and not just focusing on our own personal health when out in public, educating yourself and others on ways to help during the pandemic and ways to help keep everyone at maximum safety, finding ways to instill kind gestures or actions towards people who may need it the most, for example, smiling to someone while walking past, waving hello, thanking and showing genuine appreciation for healthcare workers and essential employees at places of business. Another way we can help is volunteering. We can do this by tutoring through Zoom, contactless deliveries of household items, meals, or notes, and finding alternatives to in-person meetings to keep yourself and others' spirits uplifted. Some other ways we can help as follow-up to the suggestions from the previous slide are reaching out to local organizations that support the homeless community, such as Love Through Sound, Schools on Wheels, Friends Indeed, Union Station, Foothill Families, Foothill Unity Center, Families Forward, and Homemade to see if there are any resources, jobs, talents, or volunteer time that you can donate to them to help their organization in any way possible. Some more ways that we can help are as follow. One of the most important aspects of helping those experiencing homelessness is encouraging others to change their perspective on the homeless. Most people possess a stereotypic view of the homeless community. It is crucial that we change the viewpoint that people share towards the homeless in order to help. A way to do so is to research and personally build your background knowledge on the homeless community and then pass that information along to others in your path. You can do this through flyers, infographics, videos, Zoom meetings, social media posts, encouraging conversations, and so many more ways. Lastly, we can participate in events organized by local organizations or schools, such as speaking to inform the public in order to help support the needs of those experiencing homelessness. You can also donate canned goods, personal protective gear, clothes, hand sanitizer, etc. If drives are too difficult to access or attend, donating to a local shelter or organization is just as amazing. So yes, these are only some of the countless ways we could help, but try and get out there and try and do as much as you can to prevent the stereotypic view of the homeless community and try to help in any possible way to relieve the homeless of the grief and hardships that they are experiencing during the pandemic.
In short, we must realize that the pandemic has brought on more to the homeless than just COVID and its effects on the rest of the population. Those experiencing homelessness have to face even more than that, including facing more cramped, unsanitary living conditions, increased disconnectivity from society, disabilities which might affect their daily and entire lives, and therefore leading to a lack to none educational opportunities, all of which hinder them from obtaining jobs for sufficient self-sustenance. But the good thing is, we are privileged enough to be able to help in all these ways we've described, from wearing a mask to reaching out to established organization, to advocating using methods such as what we're doing at this very moment. We Love Through Sound is here to remind you all that however small your impact may seem to be, you are able to make a difference. Having the privilege to watch this video means that you have the ability to give a hand somewhere, somehow, to those who have it worse than you, such as those experiencing homelessness. Let's help each other get through these merciless times. Thank you all for listening, and we sincerely hope that you're able to learn something about homelessness and impacts of COVID on this specific population through this presentation, and that you're now inspired to make a difference in the homeless community somehow. These are the contact infos for us, Love Through Sound, as well as School on Wheels, both tutoring programs and advocates for those experiencing homelessness. So please contact us if you have any questions or have interest in joining our cause. We hope you can stay safe and please help us spread love through sound.